I want to talk to you about the patient experience.
Sure.
One of the things that sort of struck me as I was going through that demo lab was the number of ways that we are reaching out to patients, the number of ways that you talked about the unstructured data, the population health booth. What I was looking at was essentially they were able to identify people for outreach, but that outreach was all automated. The outreach is just constantly happening. Is that,
Yes.
talk about the patient experience.
Sure. So it is iterative and it is ongoing. And this month is Breast Cancer Awareness Month. And we have had and continue to have a number of different mammo outreaches going on to remind people to get their mammogram. It is amazing what we've been able to achieve in terms of outreach with our patient population. And further, it is just a wonderful thing that we're seeing all ages of our population respond to these outreaches. So they're receiving the outreach on their email, they're receiving the outreach on their phone, and they're responding, yes, I'd like to schedule an appointment right now. When can I come in? And then if they have to reschedule, they click reschedule. Maybe the next day something comes up and they get to reschedule. And so the adoption has been very significant across multiple care gaps in our organization. Mammo is just one of those.
It's interesting. We were just in a room with a bunch of CIOs talking about adoption, and there's concern about AI adoption, but it's seamless, isn't it? I mean, internally, are you saying, hey, this was done with AI, or is it just like, oh, this is really great. This sort of presents itself and I just do these things?
Sure, no one, from a population standpoint, we haven't had that inquiry. However, what we have received as a result is upwards of 97% satisfaction. So we ask them about the experience at every outreach, if you will. Did they have a good experience? And it's overwhelmingly positive. But from a public standpoint, they're not asking, is this AI? And yet we're able to make it so efficient. And one lady said, I scheduled 4 appointments for my 4 children in less than 10 minutes because you made it so easy. One lady said, I am legally blind, and this was the greatest, most easiest appointment scheduling experience I've had. And likewise, we carry those forward in terms of care gap outreach.